One of the things that we do in plastic surgery these days more and more often is something called fat transfer. We take fat away from one part of the body and put it somewhere else that can use that volume. A lot of times we use fat in the face. For example, during a facial rejuvenation procedure, we're often using fat these days to volumize and reverse those volume loss areas in the face that regular facelift is never going to fix. So what are those areas? Those typically have to do with areas that sort of deplete of volume as you get older. Things like the temple region, under eye area, sort of the flatness of the cheek over here, and even sometimes right in front of a jowl that might form next to your chin. And so these are just some areas that we will inject with fat, and it doesn't plump up your face. I think there's a misconception out there that if you inject fat, you're going to just get a fat face out of it. And the answer is no. We're actually using very small amounts, but they're placed very strategically and they're harvested in a technical manner that saves the fat, so that you don't get the same problems of fat transfer that we used to see in the past, which was things like oil cysts and lumps and bumps and things like that, unusual shadowing. And so those problems, thankfully, don't happen anymore. However, it is experience-based. If you have never done fat grafting, it is a challenging technique to perform, but it is an incredibly rewarding technique, and it's almost part of almost all my facial rejuvenation procedures. Anytime I'm doing a facelift, I'm almost always taking some fat and filling in where it has been lost. So fat transfer is an excellent addition to any operative plan, but it's got to be done right, like everything else. If you have a question about this, or you just want to come in for a consultation, give us a call. We'd be happy to see you.